Good day, everyone. My name is Maribel Cunan, Information Officer of PhilHealth Regional Office NCR Central Branch. And today, I'm going to share with you things you should know for your PhilHealth registration. As PhilHealth member, we are entitled to avail the benefit packages of PhilHealth, such as inpatient benefits, outpatient care benefits, Z benefit packages for catastrophic cases, and the COVID-19 benefit packages. For complete information on the benefits, you may visit our website at www.philhealth.gov.ph. Under the Universal Healthcare, all Filipinos are automatic members of PhilHealth, meaning all Filipinos should be registered under PhilHealth, either as dependent or as principal member. Direct contributors are those members who have the capacity to pay premium contribution, such as employed, self-earning individuals, professional practitioners, lifetime members, kasambahays, and migrant workers. The PhilHealth policy and UHC laws clearly states that children 20 years old and below can be declared as dependent, while 21 years old and above shall have to register on their own as principal member unless incapacitated and has no capacity to work and pay the premium contribution. Indirect contributors, those who do not have the capacity to pay the premium contribution of PhilHealth. These include the senior citizens, NHTS or 4Ps, sponsored point of service or financially incapable. Their premium contributions are subsidized by the national government and other key government agencies, including those who are resolved by special laws, like person with disability or PWD. Assessment for qualification shall be done at the level of local government unit, specifically the city or municipal social welfare department. Registration can be done at any local health insurance office or LIU by submitting the PhilHealth Member Registration Form or PMRF along with birth certificate or any valid ID. For schools who opted to register their students, we have made special arrangement with the university to facilitate the registration. This is to ease the burden of queuing in our local health insurance offices. Membership registration is free for everyone. What we will be paying is for the premium contribution that can be paid monthly, quarterly, semi-annual, and annually. Those below and above 21 years old but financially capable are advised to register as principal member. The existing premium rate is 3% based on the monthly income of the member. The minimum premium contribution is 300 pesos per month. Yes, the student may enroll as member under the direct contributors category. However, if he or she has no capacity to pay, she or he may secure a certificate of indigency from the city or municipal social welfare office of the LGU, where his or her residence is covered. There are membership options for UP students. A. As direct contributor, for students who has capacity to pay the premium contribution. B. As indirect contributor, for students who has no capacity to pay. Students below 21 years old may remain dependent of their parents. Their name should be reflected in the member data record of their parents that shall be submitted to the school for monitoring purposes. On the other hand, they could apply or register as principal member if they opted to. The parent may update his or her member data record in the nearest local health insurance office of PhilHealth by submitting a properly filled up PhilHealth member registration form or PMRF, together with a birth certificate of undeclared child or dependent. If the guardian is financially capable, the student may apply as principal member and has to pay premium through the subsidy of the guardian. On the other hand, if the guardian is financially incapable, the student may secure the certificate of indigency from the city or municipal social welfare office of the LGU. After securing the said certificate, the student may register as principal member under the Indirect Contributor. PWD should register with local government unit through the PhilHealth Registry for PWD or PRPWT, and LGU shall forward the registry to the Department of Health. PhilHealth shall only accept those listed under the PRPWD as uploaded automatically to the PhilHealth membership database. They may verify with us if they are already in the database. If so, they are no longer required to pay for the premium contribution. The DSWD through the local social welfare office is the only agency that is allowed to perform the financial capacity assessment by using the designated DOH tool for any individual for indigency to be registered as indirect contributor of PhilHealth. Once assessed as qualified, a certificate of indigency shall be issued. The said certificate shall be submitted to PhilHealth along with the PMRF and any valid ID for issuance of member data record and ID with validity period. The minimum premium contribution is 300 pesos per month. 3% shall be paid based on the monthly income of the member, with the income floor of 10,000 pesos and income ceiling of 60,000. For calendar year 2022, it will be at 4% as stipulated under the UHC law. However, it was retained to 3% due to pandemic. The UHC law clearly states that we are automatic members of PhilHealth and we are guaranteed of immediate eligibility regardless of the status of our premium contributions. But how can we enjoy the benefits of PhilHealth without being registered? As a good citizen, we have a shared responsibility. We must do our part by becoming a member and diligently pay the premium contribution. This makes a vital contribution in achieving the objectives of universal health care. We are now in a situation that we have to protect ourselves as well as other people around us. All of us are at risk of getting sick, and not everyone can afford to pay the hospital bills. Majority are still struggling to meet the medical and financial needs. One way to provide protection against financial risk is having a health insurance that is accessible, affordable. Through the implementation of universal health care, all Filipinos are automatically covered by PhilHealth and guaranteed of immediate eligibility of the benefits. It also provides access to promotive, preventive, curative, palliative, and rehabilitative without causing financial hardship and prioritize those who can't afford the health services. The requirement for limited face-to-face among the students will not hamper the attainment of universal health care to register all Filipinos, including students, towards one healthy Filipinas. built on social solidarity. Because sa UAC, kasama tayo lahat dito. Thank you very much, and we are looking forward to helping UP in the safe opening of class.